Yes, management vis-a-vis leadership is supposed to be taking control, supposed to be executing decisions, they are supposed to be implementing policy, they are supposed to be implementing procedures. So in other words, you're supposed to play a role of supervisor, inspection, and training.
Being a doctor, you are inherently a manager because you are going to be working in teams, and many times you are going to be the one leading the teams. Or to take charge of units, for example. Okay? Could be a small unit within a department, could be the department itself, could be a hospital, could be a ward within a hospital, or even could be working with a team and you are the head in the community. You know, there is a community intervention for which you are the person chosen to make sure things happen. So managerial skills are therefore important, and therefore they should be able to use resources efficiently. They should be able to use resources effectively. They should be able to plan. Because if you plan, then the resources can be allocated and then can be used effectively. Should be able to manage themselves, so because you can't manage others if you are poor at managing yourself. So they have to be able to manage themselves, to be able to manage others, and so they have to know the management qualities. Therefore, how do you get individuals into a team that can accomplish a given goal?
For us. But no, doctors need to manage all sorts of things. They need to manage their work, they need to manage the work of other people, they need to manage the work of the team that they're part of, they need to manage their own caseload. We talked about the doctor as professional, and one of the things that a good doctor is good at is time management. So the doctor needs to be able to manage their time. Why on earth should we keep people waiting?
So if you're a clinician that do not know how to manage your time, can be confused. And then you can manage your time and also the time of your collaborators, the nurses, the technicians. So you need to manage the team because there is need for teamwork for achievements in health sector. You cannot work in isolation. If you have a team, you need to know how to manage it, because success of health profession depends on teamwork, organization, from knowing how to design the teamwork, to allocate duties, how to monitor them, how to assess or evaluate the collaborators, and how to identify areas that have some weaknesses that needs improvement. So all those skills are necessary for the team to have efficiency in its work.
Managing is about not managing people in a manipulative way, but managing people that you get the best out of them.
You manage is seen as somebody who gets the work done and also make sure that the results are achieved.
And we need, and there's a distinction in some people's minds between the role of the manager and the role of the leader. Leaders manage complexity, and managers manage change. They manage processes, and we as managers need to be able to coordinate, be able to manage complex situations and times of change. As professional, and one of the things that a good doctor is good at is time management. So the doctor needs to be able to manage their time. Why on earth should we keep people waiting just because we think we're more important? And I've heard doctors tell patients off for turning up late and saying to the patient, what a waste of my time, do you know how much I get paid and how much time you've wasted? Well, if a patient doesn't turn up, then that gives me the opportunity to catch up on other things, so it's never wasted time, but also that fails to appreciate why people are sometimes late. People have busy lives and complex and sometimes chaotic lives.